The multi-purpose Rapido by Merivara can be used as a transport trolley, operating table, recovery trolley and chair. In short, Rapido can do it all. Its variety of features make it the ideal solution for demanding day surgery needs. We have designed it with a view to promote speedier and flexible recovery and patient satisfaction. In addition, the stylish design and colours of Rapido provide a warmer and less surgical look. Rapido's mobility is excellent because of its large, smoothly rolling, anti-static twin casters, which are 150 mm in diameter. Its casters rotate a full 360 degrees, thus providing maximum manoeuvrability during transport and flexible table positioning in the operating room. The central locking device is easy to use. All casters are free. The directional caster is locked. All casters are locked. There's sufficient leg room under the base frame. The open base design also allows easy access to the patient, offering ergonomic working positions for the surgical team. The base frame and column are epoxy-coated steel covered with ABS casings. Rapido's compact construction and easy-to-clean materials improve hospital hygiene. Rapido's four-sectional and adjustable tabletop offers a variety of positions needed for different operations. The X-ray translucent top plates are made of high-pressure laminate. Rapido is equipped with X-ray cassette rails, ensuring full X-ray capability, and the use of a C-arm is well accommodated. The tabletop is long enough and wide enough to suit different patients. The conductive body-conforming mattresses fasten securely onto the tabletop with Velcro TM tapes. They are light to handle and easy to keep clean, thanks to a liquid impervious covering. The accessory rails enable easy attachment of any accessory needed for different operations. The special stainless steel material is durable in use. The size of the rails complies with European standards. In addition, other dimensions are supplied upon request. Rapido's tabletop offers a versatile range of adjustments. All adjustments are easy to make. All pedals and levers are easily accessible from both sides of the table. Adjusting the table to the desired height is done with hydraulic foot pedals. To raise the mattress base, pump the pedal. To lower the mattress base, lift the pedal. The lowest position allows the patient to get onto the table with ease. All other adjustments are gas spring assisted. The back section is adjusted either from the head section or from the side. Release the gas spring operated lever with one hand and support it with the other hand from the push bar. The platform level indicator helps to adjust the tabletop to a horizontal position. The lateral tilt adjustment is operated from the easy-to-reach handle levers. Take a good grip, press both handles simultaneously, and then tilt the tabletop to the desired position. The foot section is adjusted by releasing the adjustment lever with one hand and supporting with the other hand from the end of the foot section. The foot section is detachable and available in one or two sectional models. The head section is adjusted by releasing the adjustment lever with one hand and supporting with the other from the end of the head section. On the right-hand handle, there's a small red-marked lever for adjusting Trendelenburg and anti-Trendelenburg positions. Take a good grip on the handles and press the lever with your right hand.